Ever since President Harry Truman first proposed national health insurance in 1945, healthcare in America has been a political football, with Republicans and Democrats agreeing on the concept, but not necessarily the plan. Healthcare remains an issue and has continued to appear in campaign messages for this November's midterm election. So, to discuss healthcare and the upcoming vote and beyond, we have put together what can only be described as a blue ribbon panel.
Kathleen Sebelius served as the Secretary of Health and Human Services for President Obama. Robert Blendon, Professor of Public Health and Health Policy Emeritus at Harvard's T.H. Chan School of Public Health, and Brian Blase, President at Paragon Health Institute and former Special Assistant to the President for Economic Policy under President Trump. Kathleen, Robert, Brian, thank you all for coming on to discuss this very important issue for the midterms. Kathleen, let's start with you first. As someone who was at one point the top public health official in the country, you helped implement the Affordable Care Act, also known as Obamacare. How difficult is it to plan, craft, and implement healthcare policy given the political climate these days?
Well, as difficult as it was in 2010, I would say it's gotten even more challenging. I think the good news is, after too many attempts to even count to repeal the Affordable Care Act and litigation and Supreme Court cases, it does seem that finally the Affordable Care Act, signed in March of 2010, has been now assumed to be settled law of the land by both Republicans and Democrats. But that doesn't mean that the fights are anywhere near over. You watch them play out in the debate around the Inflation Reduction Act, about drug pricing and negotiation on drugs, about expanding some health care access, and proposals that President Biden put on the table. And we're a long way from fights about health care being over.
And I'm curious here, Bob, what the debate is constant, but I'm wondering, in this latest political moment that we're in, what is the other side saying? I get that the Democrats stand behind Obamacare, and they admit that nothing's perfect, and Obamacare certainly is not either, but it was a big step forward. The criticism has always been that you haven't heard from Republicans what their alternative is. After dozens of votes to repeal it, multiple Supreme Court cases, it's the idea of, well, what's McConnell care look like? What's McCarthy care look like? What are the Republicans fighting for on this issue? Your sense of that?
I think it's important for listeners to understand that this election is somewhat unusual. It's very focused on short-term issues that affect people's lives, not long-term, big reforms, new programs. We're talking about inflation and food, gas prices, rent. In the healthcare area, and I know it's not in your focus, abortion is the top healthcare issue at the moment for this, followed by individual healthcare prices and costs. So people are interested in voting not on healthcare reform and big bills. Can you do anything in the next 6 months to reduce the price of drugs or my hospital charges, etc.? The COVID epidemic and the changes in the economy have so disrupted people's lives. When you put in front of them in a poll a big question about the future, they just walk right by it. So it's important to understand in a few weeks we're going to vote, and it's going to be healthcare will be sort of the third level issue, and it'll be around, are you doing anything in the next 6 months to help me with the prices that I am facing? The country is not focused on overall spending, things that experts talk about. But it's important to understand that very short term, and abortion went from 11th to 4th since 2018 because people are asking themselves, am I going to be living in Texas or California in 2 months on this issue? It's very short term. And if the price of gas goes up, you'll see voters getting nervous again. So it's very short term. These big questions about how the parties will reform health care are really not on the ballot when you interview people.
That's really fascinating.
Yeah.
Brian, I want to pull you into this conversation because you worked as an aide for former President Donald Trump, so you might have a gauge on what Republicans are after. I've been looking at a Political magazine article that says Republicans have stopped trying to kill Obamacare, which is interesting because since it's been enacted in 2010, all we heard on the campaign trail was repeal and replace, and that is non-existent, it seems, this time around. Do you know what their plans might be if they retook the House and the Senate and were a majority in Congress?
Sure. I mean, I think the idea is going to be what can be done to increase patient choice and control. 90% of the spending in healthcare is not done by patients. It's done by government programs. It's done by health insurance companies. We don't have a patient-driven healthcare system. We really have a bureaucracy-driven healthcare system. It's one of the reasons there is so much political fights in healthcare. It's because half of the spending, half of the revenue that insurers and hospitals get comes through government programs. So there's huge power in influencing the federal bureaucracy and politicians. So I think what we need to do is depoliticize healthcare, restore patient control, expand things like health savings accounts that allow patients to control their health decisions. And also look at what is inhibiting competition. There's a lot of government policies that restrict doctors and providers from best meeting patient needs. Things like certificate of need laws that prohibit hospitals from expanding capacity in certain places. And of course, we need to be focused on policies that enhance innovation. I think there's a lot of concern coming out of the government's response to the pandemic that the public health agencies need significant reform. And I think that would be a focus for Republicans in the next Congress.
So, Kathleen, before we hit the break, your reaction to what Brian just said.
Well, I think most Medicare beneficiaries, for instance, would not feel that their government controls their decisions. They love Medicare, and that is a government program that provides enormous benefits both in the private and the public sector. Most people who have Medicaid like the program that they have. It's the largest insurance program in the country, run by private companies with a state-federal partnership. So you're right, a lot of people have federally provided, state-provided health insurance, but I think the notion that those programs somehow should be privatized, which is really what the suggestion is, should be turned over to patients. I think what we found in the past is patients are horrified by that idea, that you put a senior out in the marketplace and give him or her a voucher and say, go shopping for the benefits you want or need. People don't want to do that. They want a package of benefits. They want to know that the government has used their enormous leverage to drive the cost down. And year after year after year, government insurance programs run at a far lower administrative cost and far lower cost for the beneficiaries than any private insurer does. We got to look at employer-based health insurance, help employers provide that more economically, look at systems, but the government programs provide the most comprehensive services at the lowest price.
We're going to continue the conversation. Stay right there. We'll take a quick break and be right back.
You're watching Newsy. For more, go to Newsy.com.
Victims of mesothelioma and their families may be entitled to receive a cash award from over $35 billion in asbestos trust funds now available. Over $50 billion has been awarded already. If you have been diagnosed with mesothelioma or lung cancer caused by asbestos, call the number on your screen now. We have served victims of mesothelioma and their families nationwide for over 30 years. We have successfully recovered hundreds of millions of dollars for thousands of our clients. Even if a family member has passed due to mesothelioma, you may still be entitled to a cash award. So call now for your free evaluation. We want to help victims of mesothelioma and lung cancer, and your families get the financial compensation you deserve from the over $35 billion in trust funds now available. If you or a loved one has been diagnosed with mesothelioma, call 1-800-914-1579 now or visit us at mesofund.com.
I don't like to spend a ton of time shopping, but I like to look good. For me, Poshmark makes that so easy. And whenever I get tired of something, I just relist it back on Poshmark. It's honestly a little addicting, making some money I can spend, keep my wardrobe fresh.
Why pay over $100 a month for cable when it's half the cost for Fubo TV? Get all the channels you want with all the entertainment you love for the price that cable can't beat. Try free at FuboTV.com.
Teaching her how to drive. But Dad, why not use Greenlight to help her save for her own car? Mowing lawns, getting paid. Oh, smoothies. Is that strawberry? Soon, she'll go from washing your car to flexing with her own. Even better, teach her how to invest in cars. Together, you can navigate the world of earning, saving, and investing. Because when you teach her how to be smart about money, she'll go far. Real far. Invest in your best investment. Greenlight.
I have, over my 30 years, seen many patients who have excessive sweating. It is very much a confidence killer. Excessive sweating is not something you have to live with. I recommend Carpe for my patients.
Carpe is by far the most effective antiperspirant I've ever used.
I love Carpe. Now I don't sweat.
Effective and affordable. It's a game changer.
Avoid expensive treatments, injections, and prescriptions. Your total body sweat solution is available at mycarpe.com. Visit today and get free shipping.
Introducing Anolon X, the only nonstick engineered for flavor with the exclusive SearTech technology, a unique base and a stainless steel mesh that ordinary nonstick pans don't have. Engineered to keep oil in the middle of the pan, directly under food, caramelizing and searing better, to create the flavors that stop conversations. Shop now and get free shipping at AnolonX.com.
Welcome back, everybody, to our health care as a midterm issue panel, trying to break down a very complicated and politically volatile issue, which is not easy. Bob, let's get things restarted with you. There are more than 85 million Americans who are underinsured or not insured at all. I think people make a general point that that's a staggering stat in the richest country on the planet. Why is it? And is there anything that's politically palatable that we can do about it, regardless of who's running the show on Capitol Hill?
So I want to be clear of sticking to the election, because in a few weeks we're going to be writing stories. What people are looking for at the moment is not extending insurance coverage. It's finding a way to lower prices of pharmaceuticals, hospital charges, physicians, fees. They're really bothered. They can't pay the fees they have. And so they're looking for anybody politically that can say, we can lower the fees, the charges. We're going to look at what these hospitals are doing. And that's the issue on people's mind. It's not extending insurance coverage.
What's the best way to do that then? Sorry to interrupt, but what's the best way you can do that?
You have to ask your colleagues. I ask voters about what they care about. My colleagues here have recommendations about what to do. But it's really important, the price of drugs, as we just discussed, why the hospital charges. People are, when you interview them, are talking about emergency room charges. Why are they so high? And to a degree, a political party can say something about that very practical problem. It's like the price of gas. Please tell me you're going to lower it. Don't talk about long-term reforms. For this election, it's very short-term. People want to judge what's on the table. The drug price bill has a problem.
Kathleen, go ahead and jump in. Bob, 1 second. Kathleen, go ahead and jump in.
Yeah. Well, I would agree that prices are absolutely the issue, and I think it's why you saw Democrats really move on the Inflation Reduction Act to drug pricing. This has been a topic for 10 years, and they finally have a foot in the door. Medicare, who buys the most drugs in the country, can finally begin to negotiate for drugs. It will drive down costs. They capped insulin, which is taken by a lot of seniors, at $35. A copay, they are going to cap out-of-pocket costs. And so they hear that message. But I live in a state which still has not expanded Medicaid. And I would just disagree with Bob slightly. I can tell you in this state, the interest in making that a policy decision is being debated by the gubernatorial candidates. Our current governor would like to expand Medicaid. Her opponent would not. That's a key issue because people see that. The uninsured in this state who are not eligible for Medicaid benefits see that as their pathway to lowering their own health care costs and having access to affordable medication. So in a state where that issue is very stark, I think expansion is very much on their mind. They see it as a cost issue. Bob is absolutely right, but it is also an expansion issue.
So, Brian, over to you now. The last members of the baby boomer generation, they're now entering that age range where they're going to require more medicine, more personal care, more health checks. Now, we already know that, right, as of now, Medicare might not be sustainable for future generations, but the issue of long-term care is one that not a lot of people are talking about right now. So what can we do from your vantage point to improve long-term care in our country for the people that need it the most?
Yeah, thanks for the question. It's actually Paragon, the think tank that I lead. It's our most recent policy paper is the long-term care problem. And I mean, one of the big problems with long-term care is the way the Medicaid program currently works. It's too easy to get onto Medicaid for people to pay for their long-term care. People expect Medicaid or Medicare to pay for their long-term care expenses. And it really discourages proper planning for individuals when they are young and healthy and can plan for these expenses as they get older. To some of the previous points, I'd say affordability is a big issue. The average premium plus deductible for an ACA plan right now is $25,000. That's unaffordable for the vast majority of people. The only people that buy those plans have to get huge subsidies to purchase them. I think we've got a big problem with our policy where we keep subsidizing inefficiency, and those subsidies just drive up prices and premiums over time. I do think as far as solutions, there are some bipartisan solutions to get at high costs. There's been price transparency efforts. They were started by the Trump administration with rules requiring hospitals and insurers to post price information. They have been continued by the Biden administration. So it's bipartisan efforts to get price information out to help consumers, to help employers as they're shopping for care. I'll mention another positive policy coming out of the Biden administration, over-the-counter hearing aids. It was actually law signed by President Trump, but a regulation recently implemented by the FDA under President Biden. Seniors should have access, people should have access to over-the-counter hearing aids. A lot of people with hearing deficiency, hearing loss haven't gotten the assistance that they need. It's much more costly if you have to go get a prescription to get a hearing aid. People don't do it. Yeah. Having hearing aids over the counter is a really common sense move, and things that we can start doing to, again, expand consumer choice and increase competition in the market to lower prices.
Such a complex, nuanced discussion. We know so much is talked about the economy, abortion, but healthcare is still on the radar as well. Kathleen, Sebelius, Robert Blendon, Brian Blase, we appreciate you all coming on this morning. Thank you.
Thank you.
We'll be right back.